we, the Final Year Basic B.Sc Nursing student of Seva Mandal Education Society, SMT Suranda Praveen Gambichan College of Nursing, are going to give you some interesting information about occupational disease, its prevention and awareness. Now, worldwide, this day is celebrated on 20th April as Safety and Health for Workers. So, as we are part of healthcare workers, we are going to discuss the occupational hazards and its prevention in the healthcare settings. So, let's move to another videos.
Health and well-being of the people living in the country decide the development index of country. The health of working population play a vital role in bringing prosperity and development of the nation. Their contribution directly responsible for improving the economy and the gross domestic product of the country. In a developing country like India, health of the working member is much more important to feed the family member and sustain the family. Workers contributed one-third of work population and are the major contribution of growth and development.
Occupational health. WHO defines as occupational health is a multidisciplinary activity at protection and promotion of a health worker by preventing and controlling occupational disease and accident by eliminating the occupational factors and continuous hazards to the health and safety at work.
Stakeholders of occupational health. First is national government. As the signatories of WHO 1996 Declaration of Global Strategies for Occupational Health for All, the government of the countries have a responsibility to ensure implementation of measures to promote occupational health. Second one is management of industries and enterprises. The management of factories, whether public or private, needs to take measures to ensure safety at work environment and also prevent ill effect of occupational exposure to hazardous substances. Third one is workers' employees. The employees have to be aware of the possible ill effect of work-related processes and the environment. They have to follow safety norms and create safe work culture. The workers' role in achieving occupational health cannot be compromised. Fourth one is trade unions. Trade unions should be vigilant to ensure that the necessary occupational health and safety measures are implemented, and in case of lapse in safety issues and health measures, they can negotiate with the representative of the management. Fifth one is community. Community members also play a vital role in ensuring safe work environment. A community residing around the factory or industry is invariably affected by the processes and products used in the industry. Hence, maintaining the health of the community depends on the safety at the factories.
The occupational health team. The members of the team have their unique specified roles to play to ensure occupational health. The occupational team consists of the following. First, consultant specialized in occupational medicine. Second, occupational or industrial nurse. Third, industrial hygienist. Fourth, environmental and safety engineer. Fifth, ergonomist. Sixth, physiotherapist. And seventh, counselor.
According to WHO, healthy workplace are four characteristics: physical workplace, healthy work culture, personal resources, community environment. In physical workplace, free from physical, chemical and biological hazards, healthy work culture, mutual respect and collaboration. In personal resources, healthy habits, adherence to the safety precaution, and in community environment, maintenance of community well-being and safety.
Some common occupational diseases. So first is including cirrhosis, due to the exposure of celiac dust and particularly in industries. Next is abscesses. Linked to abscesses, exposure is often found in industry. Third one is noise-induced hearing loss, prevalent among workers in noisy environments. Fourth one is respiratory disease, including bronchitis, asthma and chronic obstructive pulmonary disease. Fifth one is skin diseases such as dermatitis and commonly observed among the workers handling chemicals and dyes. Sixth one is musculoskeletal disorders and STDs resulting from repetitive movements or poor and in industries like agriculture and construction. Next one is leading poison, occurring in workers exposed to lead-based paints, batteries in industries and materials like constructions and manufacturing. And last one is occupational cancers, including lung cancer and exposure of skin cancers and exposure in sunlight, outdoor occupations and related to chemical exposure in various industries. Thank you.
Occupational health hazards, which include physical factors, chemical, biological and behavioral factors. In physical factors, heat, light, noise, radiation. In chemical factors, industrial dust, heavy metals such as lead, zinc, iron, benzene, toluene gases, acids, alkali and pesticides. In biological factors, inhalation of live organisms or spores, and in behavioral factors such as ergonomics related factors.
So I am going to tell you about the common occupational health diseases. First, occupational lung disease, which include pneumoconiosis, silicosis, asbestosis, occupational asthma, occupational dermatitis, occupational cancer. Second, work-related musculoskeletal injuries, which includes disorders of muscles, nerves, tendons, ligaments, joints, cartilage, and spinal disc. Third, occupational injuries and accidents, which includes example oil gas tragedy.
Occupational musculoskeletal problems among nurses and healthcare workers, especially back injuries, sprain, shoulder strain, neck injuries. Find these problems and carpal tunnel syndrome, etc. The primary cause of musculoskeletal disorders in nurses and healthcare workers is patient handling tasks such as lifting, transferring, and repositioning of patients.
Work-related musculoskeletal injury. In that, get help from other personnel or other assistant devices. Never try to lift or manually handle the patient alone. Be mentally and physically prepared for manual handling of the patient. Give appropriate instruction to your colleagues and helpers for coordinate movement. Ensure that the floor is non-slippery and avoid high heels while at working. Use the principles of body mechanics very well for handling the patient manually. Have a wide base of support with legs firmly footed on the ground. Avoid twisting or bending at the hip level. Use large muscles group rather than strengthening the small muscles.
Today I am going to discuss about common types of injuries at workplace. First is slips and fall accident. Second is neck and back sprain. Third is falling object. Fourth is chemical inhalation. Fifth is exposure to loud noise. And sixth is collision and crashes.
Occupational injuries and accidents. Major accidents happens at workplace. Causes of accidents can be administrative factors, employee factors, and sudden default in gadgets. Administrative factors consist of defaults or malfunctioning machine, inadequate workman strength, improper design and engineering, inadequate training to employees, and lack of supervision. Same as employee factors include poor awareness about the risky process and hazardous substance, non-adherence to safety and control of mechanisms, deadline-oriented work, protected equipments are not carried out, faulty operations, fatigue factor and overnight or oversight due to overworkload, and too much diversion of attention from workplace.
Primary prevention of occupational accidents. So first is a periodical checking of functional status of the machines and removing the worn out ones from the operations. Second is a standardizing the operation and processes. Third is the regular induction programs for new employees. Next is the measures to avoid human factor of fatigue etc. by providing proper working conditions and amenities. Next is the installation of altering devices in the event of faulty operations, realizing dangerous chemicals or fumes on the fires. Next is the automation of dangerous operation. Next is re-engineering industries and factories for safe work environment.
Nurses and healthcare workers face various occupational risks including exposure to infection, disease, physical strain from lifting patient, workplace violence, and psychological stress for demanding work environments. These risks underscore the importance of adequate training, safety protocols, and support system in healthcare settings. I'll be listing down some of the various occupational risks faced by nurses and healthcare workers. These are workplace violence, psychological stress, chemical exposure, needle stick injuries, respiratory hazards, radiation hazards. Thank you.
Standard safety precaution and wearing appropriate
appropriate personal safety wear such as gown, mask, and gloves and goggles. To hand washing and hand hygiene protocols. Follow biomedical waste management protocols. Vaccination to diseases such as HPV, TB, sectional flu, and varicella. Precaution while handling and sharpen needles, not recapping needles, discarding used needles in puncture-proof container. In case of sharp injury with needles or scalp contaminated with HPV or HIV positive patient, following appropriate sterilization and disinfection protocols including environment, maintaining general well-being and nutritional status.
Is for prevention of occupational hazard. In that, pre-placement examination, periodical health checkup and referral system, medical and physical care facility, supervision of work environment, maintenance of analysis of records, personal protective devices, provide a safe working environment to the workers, health education and counseling.
For the strategic prevention of the occupational diseases, the Occupational Health Program was initiated by the Government of India in the collaboration practice with WHO and ILO. The success of this program is dependent upon the coordination and cooperation between the government bodies, health organization, industry organization.
What's the employees? Safety and health is not just for specialists and professionals. Employees have great role to play in ensuring occupational safety and to promote occupational health. An employee is expected to follow safety guidelines while at work, take active part in ensuring safety, be aware of hazard present in the work environment and consistently wear PPE, sensitize the fellow workmen and employer in case of any unsafe gadgets or malfunctioning, machinery or work progress occurring in industrial settings.
Role of health team members of physicians play important role in early detection and management of workers who are affected by occupational disease, and he participate in health research and organize and coordinates unit-based surveillance.
So I am going to tell you about the nurse's role in occupational health program. So first is conduct the periodical health checkup and organize the screening program for the workers. Second, assess the vital environmental parameters to identify any threat to health. Third is initiate the primary prevention by modifying the workers' environment of changing the workplace. Next is delivers the curative and rehabilitative services in collaboration with the other health team members. Next is maintain the environmental health thereby playing a role in safeguarding and general well-being of the people living in the communities adjacent to the industries. And last is provide the counseling and guidance to workers on complex health issues.
Indian occupational health have four perspectives. First is National Occupational Health Policy on Safety, Health and Environment at the Workplace, in which the National Health Policy aims at providing the health and safety of workers by eliminating the works-related injuries and disasters and loss of aspects and life by protecting efforts. Second is the National Program for the Control and Treatment of the Occupational Disease, in that the health risk assessment, identification and hazardous process and development of the interventions program. Third is training and the capacity building and the research, in which the Central Labour Institute and the National Institute of the Occupational Health provide training to the occupational health and the professionals. Fourth is the challenges in occupational health in India. In this, the poor awareness of the health hazards by the largely less educated employees and the availability of only few trainings occupational health manpowers.
National Occupational Health Policy on Safety, Health and Environmental Workplace. The National Occupational Health Policy proclaims that the occupational health and provision of safety and workplace are fundamental rights of workers. The National Health Policy aims at providing health and safety of workers by eliminating work-related injuries and disasters and loss of assets and life by a proactive efforts. It also aims at ensuring provision of a human and safe work environment for employees and elimination of abuse of children at work. It pledges for a sustainable enterprise development through creation of green jobs and thereby improves safety, health and worker environment. Another area of a national occupational health policy is continuous improvement and community education, creation and awareness about the occupational safety.
The Ministry of Health and Family Welfare, Government of India launched the National Program for Control and Treatment of Occupational Diseases in 1998-1999. The National Institute of Occupational Health, Ahmedabad, functioned as the nodal center for the same. The National Program for Control and Treatment of Occupational Diseases focuses on the following areas. After the Bhopal gas tragedy, the Act has taken many measures to ensure the occupational health of factory workers by enforcing some restrictions while working in the factory. These restrictions are as follows.
Training and capacity building and research. In that, the first is the training and awareness, including training programs are essential for raising awareness among workers, employees and healthcare professionals about the occupational diseases. The second one is the capacity building. Including the capacity building initiative focuses on enhancing the skills, knowledge and resources of individuals and organizations involved in occupational health and safety. The third is the research. Research plays the crucial role in advancing our understanding of occupational diseases. And the fourth is the integration. Integrating training, capacity building and research effort to create a comprehensive approaches to many occupational diseases. And the fifth one is the collaboration. Collaboration between academic, industry, government, agency, healthcare institution is essential for promoting research-driven policies, implementing effective training programs, and building sustainable capacity in occupational health.
Let's see the challenges in occupational health in India. There is a huge unorganized sector that does not come under the legal provision of occupational health. There is a poor awareness on the health hazards by the largely less educated employee and availability of only few trained occupational health manpower. Because of these factors, implementation of risk assessment and surveillance and installation of preventive strategies in hazardous process or industries suffer greatly. All the stakeholders, including employee and employers, need to be educated about the benefits of preventive strategies.
Now seen, including program for nurses focus on preventing occupational hazards included following component. First, introduction to occupational hazards, safety protocol and procedures, risk assessment, preventive measures, health and wellness, continue education, safety culture. By implementing this comprehensive including programs that address by areas, healthcare organization empower as nurses to effectively identify, prevent and mitigate, promoting occupational hazards, ultimately safer work environmental by both staff and patient.
Industrial nurses play a critical role in occupational health and safety within industrial setting. They are responsible for providing medical care and promoting wellness and preventing injury and illness among the workers. Their duties including conducting health assessment, administering first aid, educating employees on health and safety practice and collaborating with the management to create a safety work environment. Additionally, they may be involved in managing workers' compensation claims and facilitating rehabilitation programs are injury employees. Overall, industrial nurse help ensure the well-being of workers while promoting productivity and compliance with the health and safety of regulations.
Role of industrial health. In that four components. First is the anticipation. Second is the recognition. Third is the control, and fourth is the management. First one is the anticipation. In that, planning, commitment, design and training. Second one is the recognition. In that, hazard identification, monitoring studies, and third one is control. In that, engineering, administration, and protective equipment. In last is a management. In that, planning and implementing management, review and self-assessment.
Counselors plays a crucial role in addressing occupational hazards by providing support, guidance, and resources to individuals dealing with workplace stress, trauma, or other challenges. They place employees cope with job-related issues, develop coping strategies, and promote overall mental well-being in the workplace. Additionally, counselors may offer training and education on stress management, conflict resolution, and resilience building to prevent occupational hazards and promote a healthier work environment. So I will list down some points about the occupational. What are the roles of occupational counselor? Assessment, support, crisis intervention, coping strategies, education, advocacy, referral, prevention, follow-up, support, and documentation.
Standard precautions are meant to reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized sources. They are the basic level of infection control precautions which are to be used as a minimum in the care of all patients. PPE, personal protective equipment, protects the healthcare worker from exposure to blood and body fluids and substance. PPE includes gloves, fluid-resistant gown, apron, eye protection, face shield, and surgical mask. PPE must be changed between patient or when soiled. Gloves. Gloves wear when touching blood, body fluids, secretions, excretion, mucous membrane, and non-intact skin. Change between task and procedure on the same patient after contact with potentially infectious material. Gloves should be removed after use, before touching a non-contaminated item and surface, and before going to the another patient. Perform hand hygiene immediately after removal. Facial protection. Wear eye protection such as eye visor, goggles, or face shield to protect the mucous membrane of the eyes, nose, and mouth during activities that are likely to generate splash or sprays of blood, body fluids, secretion, and excretion. Waste disposal. Ensure safe waste management. Treat waste contaminated with blood, body fluid, secretions, and excretion as clinical waste in accordance with the local regulation. Human tissues and laboratory waste that is directly associated with specimen processing should also be treated as clinical waste. Discard single-use item properly. Respiratory hygiene and cough etiquettes. Person with respiratory symptoms should apply source control measures. Cover their nose and mouth when coughing, sneezing with tissue or mask. Dispose of used tissue and mask, and perform hand hygiene after contact with respiratory secretions. Needle and sharp instruments. Used needle should be discarded immediately after use and not recap, bent, cut, removed from the syringe or tube holder or otherwise manipulated. Any used needles, lancet or other contaminated sharp should be placed in leak-proof, puncture-resistant sharp container that is labeled with biohazard label. Do not overfill sharp containers. Discard after 2/3 full or when contained are the full line indicate on the containers. Used sharp containers may be taken to a collection facility such as area, pharmacy, hospital or clinic that provides this service.
Hand washing. Wet your hands and apply soap. First, rub your palm together. Second, rub the backside of your hands with fingers interlaced. Third, interlock your hands and rub together. Fourth, clean your knuckles. Rub your thumb. Clean the tip of your fingers. Then wash your hands.
Here we have seen what are occupational hazards and its causes and its prevention. So I hope you will implement all these precautionary actions in your work and at your workplaces. Thank you.